Thanks for watching TMA's Legislative News Hotline for Sunday, May 21st. I'm Brent Anier. We've reached the point in the legislative session when hundreds of bills are on the move. Many of the bills important to Texas medicine are still in play. Some are close to getting a final vote, while other bills are on their way to the governor's desk. This time, we'll hear from a physician leader about how Texas should handle the threat of infectious diseases like the Zika virus. And another key physician will weigh in on a bill to broaden the sale of raw milk. But first, a scorecard update on some priority bills TMA is tracking. The TMA-supported step therapy override measure, Senate Bill 680 by Senator Kelly Hancock of North Richland Hills, is now on the governor's desk to potentially become law. The Senate concurred with the House's amendments on Tuesday to finalize the measure. Senate Bill 680 would allow physician override of a health plan's step therapy protocols, allowing a doctor to continue to prescribe an effective medication even if the insurer's step therapy plan calls for a change in that medication. Before the end of the session, the governor has 10 days to act on a bill. If he doesn't do so by the deadline, the bill becomes law anyway. So as of this taping, Governor Greg Abbott has about a week to act on SB 680. Another bill will be sent to the governor. Thursday, the Senate enrolled or gave final passage to the bill to regulate the practice of telemedicine in Texas. Senators concurred with House amendments to Senate Bill 1107 by Dr. Senator Charles Schwertner of Georgetown. The House sponsor is Representative For Price of Amarillo. The bill says the same standard of care applies whether in a traditional in-person setting or in telemedicine care. It also prohibits a health plan from excluding telemedicine from coverage just because care isn't provided in person. Late Friday, a big development. The Senate gave its final passage to House Bill 62 by Representative Tom Craddock and Senator Judith Zaffirini, which bans texting while driving statewide. Next, the House must concur in amendments to give the bill final passage or enrollment. Then it heads to the governor, too. Meanwhile, several bills TMA supports were voted out of committee and advanced for a floor vote. House Bill 10, which would create mental health parity, advanced out of the Senate Business and Commerce Committee on Wednesday. The measure by Representative For Price of Amarillo would establish a state mental health parity work group, designate an ombudsman as an advocacy resource, and clarify benefit terms and coverage for mental health and substance abuse. Here are some other TMA-backed bills that made it out of committee this week. The Senate State Affairs Committee passed Senate Bill 1148 by Senator Dr. Don Buckingham of Lakeway. The bill would end discrimination against physicians who elect not to pursue maintenance of certification for hospital privileges and health insurance participation. Senate Bill 833 by Senator Brian Hughes of Mineola was voted out of the House Public Health Committee. SB 833 improves corporate practice of medicine law by protecting physicians employed by nonprofit health corporations when they speak out in patient care quality issues. Of course, the budget is the top priority for the legislature. While the House-Senate Budget Conference Committee finishes the budget for the next biennium, lawmakers still need to pass the supplemental budget bill for this two-year cycle. The Senate Finance Committee took a big step forward on Thursday, passing House Bill 2. According to news reports, senators voted to spend about $800 million in state funds to cover a Medicaid shortfall in the current budget. Add to that $1.6 billion from the federal government. The bill goes to the full Senate for approval. A Senate committee is now considering a House bill that enhances the state's ability to test and screen for infectious diseases like the Zika virus. TMA supports House Bill 3576 by Representative Bobby Guerra of McAllen, which clarifies how communicable disease data is collected, tested, and shared. TMA Committee on Infectious Disease Chair Dr. Phil Huang testified on behalf of TMA on Wednesday. He stressed that screening, testing, reporting, and monitoring of infectious diseases is a core function of public health. Dr. Huang told the committee that the bill would ensure that state and local public health agencies can participate in some of the CDC national surveillance efforts regarding Zika and would allow access to the National Pregnancy Registry to track Zika-related births.
The bill, I think, clarifies some language in the Texas Health and Safety Code that might have been affecting our ability to participate in national surveillance from some infectious disease. And particularly, we're talking about Zika at this point, but it applies to any other high consequence infectious disease in the future also.
The committee left the bill pending. A bill to expand the lawful sale of unpasteurized milk sailed through the Senate on Friday. TMA opposes Senate Bill 95 by Senator Bob Hall of Edgewood. The bill would authorize expanding the sale of raw milk and raw milk products to farmers markets. The bill is moving very quickly. The Senate Health and Human Services Committee passed the bill on a 6-to-1 vote to send it to the Senate floor just this past Tuesday. A recent Centers for Disease Control and Prevention study showed consumption of unpasteurized milk and cheese caused 96% of illnesses from contaminated dairy products between 2009 and 2014, even though only 3.2% of the population consumed raw milk and just 1.6% consumed unpasteurized cheese. Still, some people believe consuming raw milk has health benefits over pasteurized milk. But Dr. John Carlo, Vice Chair of the Texas Public Health Coalition and a former county health authority, says no scientific studies back that claim.
Raw milk is not a safe product to consume. There's really no way to safely transport it, refrigerate it, preserve it. It's really just not a safe thing to do. And the last thing is there's really no evidence that says consuming raw milk is healthier than consuming pasteurized milk.
That's it for this week. I'm TMA's Brent Anier. Thank you for watching, and please join us again next week for TMA's Legislative News Hotline.